Hello everyone, I'm Stacy and I'm presenting my stance on one small cut that killed. The situation is as follows. A primary care physician saw a patient in our clinic with right ankle pain. The patient was a farmer named Joe and states that he fell down in his chicken coop, and his injuries were some cuts and some bruises on his left leg and a swollen right ankle, with the right ankle being his chief complaint. The physician instructed Joe to buy an air cast, take some ibuprofen, and take it easy. 3 days later, Joe is admitted to the ICU with sepsis to the left leg wound and dies 2 days later. The family is understandably upset with many questions, and the hospital is pressuring the physician to apologize to mitigate legal trouble. The physician is afraid if she apologizes, she's admitting guilt and she may be legally and professionally in trouble, and she's afraid of what her colleagues and patients will think of her if she admits this error. I pick for apologizing, and the ethical principle I stand on is integrity. According to the article provided by Dr. Wilson, Making Ethical Decisions, integrity means that the ethical person acts according to his or her beliefs. While deciding on what she should do, the physician should go through the process of ethical decision making. This includes asking herself what will be the effect on myself, the victim's family members, my coworkers, my institution, and my other patients if I do or do not apologize. She should ask a mentor or peer for their insight. Most likely there is someone else in her circle that has faced a similar situation that can assist her with her dilemma. She should ask herself, what will the consequences be if I do or do not apologize, and what can be done to prevent this from happening in the future. From the limited information I have, it appears the mistake that the physician made was not giving the client teaching regarding wound care and signs or symptoms the client may experience that warrants an additional office visit or an ER visit. If this is the case, then an apology is in order. Either way, there may be a lawsuit, and not apologizing increases the risk of being sued. I'm not saying she should apologize to prevent being sued. I'm saying she should apologize because it's the right thing to do. We're all human, and care providers make mistakes. Having integrity in saying, I'm sorry that I was not more specific in my teaching to your father. If I had taken a little more time with him, this may not have happened, shows respect for Joe and his family, and takes accountability the errors that were made, like a prudent provider should. Most likely, this physician feels horrible regarding the outcome and is likely to never overlook what appears to be minor signs or symptoms again. Thank you everyone for listening.